Good morning. It's another Thursday morning, and welcome to Stories for a Better Normal. I know I should see you every 10 a.m., but technical glitches happen, and that is why we need Dr. Rene Samaniego, Dr. Jasmine Vergara, and our social worker, Prednison Morales, who will speak about mental health. The Stories for a Better Normal has been tackling ecological solid waste management. That's a reason why we've partnered with Sonia Mendoza and the Mother Earth Foundation. We've been discussing about sustainable mobility and the need for everyone to have more access to the road through bike lanes and protected bike lanes. And that's a reason why we partnered with the Institute for Climate and Sustainable Cities and Climate Reality Leaders, Philippines and Red Cross Antino. We've also been discussing agriculture, agroecology, permaculture, organic farming, rural gardening, and urban gardening. And we've discussed that in the past few shows. Today, we focus on what's most important perhaps is not just to take care of the body, but also to take care of our soul, our mental health. And a few years ago, I co-authored the Mental Health Act, which was signed into law 2 years ago. The then president of the Philippine Psychiatric Society, who is a practicing psychotherapist and psychiatrist, is Dr. Rene Samaniego. He's joining us today, who will do a comprehensive presentation. Also joining us is an expert from the World Health Organization, Dr. Jasmine Vergara, whose practice also includes other countries like Palau. And of course, a social worker from the team of Senator Gordon in Philippine Red Cross. We have Mr. Prednison Morales later on. And welcome to our Facebook friends. Congratulations for those who've already planted with their DA kits. Department of Agriculture have been giving away their starter kits for urban gardening, and in every show, we'll be giving you starter kits and mga buto. O Ipat Luna, you're with us now of the DNR. Yes, we are giving away seeds because even in this show, we don't just segregate waste at source, recycle, and compost. We also save our seeds. And 1 minute, let me just show you that my lavender, I think, is a calming mechanism. I don't know. I think so. Tinanim ko ito sa simula ng pandemic, hindi ba? Ang yabong, ang dami-dami. They say that herbs and plants really are a relaxing component of our lives. Well, I've been a lover of nature for so long, but let's go straight to the point. We'd like to hear from Dr. Rene Samaniego, and you can ask our experts all the questions, and we will try to answer as much as possible. So welcome our Facebook friends, and we'd like to hear and see the presentation of Dr. Samaniego. Good morning, Doc.
Good morning. Hi.
Good morning.
So, yeah, first off, just a quick thank you to Deputy Speaker Lauren Legarda and, of course, to the organizers of this online event for the invitation and the opportunity to share with our participants this morning, specifically on the mental health angle of this global pandemic that we are all faced with. So I have a presentation which I am sharing with all of you now. So I just want to confirm if it can be seen on the screen already.
Yes, I can see it. Confronting the mental health challenge of COVID. Yes.
Yes. So I think that we will all agree that from the get-go of this COVID-19 pandemic, our main concerns have really been centered on how the virus can potentially threaten our physical well-being. No? And of course, I think our strongest worry or fear is actually being infected by the virus, whether being infected ourselves or our loved ones. So we all experience that worry or fear to varying degrees. And having said that, it is a normal reaction for us to be apprehensive and anxious. And then on top of that, there are all these other associated anxieties like, is our government and our healthcare system able to adequately manage our health crisis? Or if so, will they be able to continue doing that over time? But basically, what we are saying is that relatively very little attention is actually being paid to the mental health consequences of the pandemic. And to a certain extent, I think this is quite understandable, right? Because in the acute or earlier stages of a crisis, of this kind of crisis, the emphasis should really be on the more urgent priorities, anyways, such as caring for the sick patients. We need to also tend to the needs of our healthcare providers so they can meet the challenging medical demands while keeping them safe at the same time. There's also the importance of working on containing the virus so further spread in the community can be prevented. We have had to expand our hospitals' capacities, even put up quarantine facilities to accommodate more patients. And then on top of all of these, we also need to work on developing effective treatments for the virus, whether curative or preventive, such as the COVID-19 vaccine. But meanwhile, there's this generalized global distress and anxiety, no, that all of us are experiencing as a consequence of the pandemic. So, to begin with, I think we will acknowledge that our lives and our daily routines have been completely disrupted. So we have been isolated from each other, with the length of the isolation varying, no, depending on the density of the cases in your specific area. So I know that we have already transitioned from ECQ to GCQ. There are some places who have done that, but there are still some places have been maintained on ECQ because of the high prevalence or high cases of COVID in their area. Um, there's also the economic and financial losses that we continue to accumulate over time. So, what I'm trying to say is that all of these things can definitely have adverse effects on our mental and emotional well being. And that is what we refer to as the psychological sequelae or the psychological consequences that will eventually emerge or may actually be emerging already. And that is even as the pandemic eases up. No? And it may persist for months or even years, they say, even after the end of the pandemic. And right now, we still do not know what the extent of these psychological effects will be, no? Because even if we have been dealing with both natural and man made disasters for the past years and decades, I think they really cannot compare to the scope of this COVID 19 crisis. Maybe the historical event that we can somewhat compare this closest to was the Spanish flu pandemic in 1918, no? And the rest, such as polio, Ebola, or HIV, or MERS, and SARS, and swine flu. So all of them were actually relatively smaller in scale and maybe less disruptive in a global scale. Similarly, I don't think we can also compare it to the effects of man made disasters like 9/11 or natural disasters like Hurricane Katrina or our most recent Taal volcano eruption in January of this year. I don't think we can compare it to that, no, simply because their effects were more constrained in terms of space and time, in contrast to COVID 19, the effects of which are global in magnitude. So, So, how do we meet the mental health challenges of COVID 19? So, really, the most basic step that we have to do is to take that we need to do to stem the tide or to neutralize the psychological sequelae, or maybe even neutralizing the cumulative psychological stress and impact of the pandemic, is that we really should begin with identifying individuals who are already at risk of developing these concerns. Now, who are these people who are at risk? No? So first and most importantly are the individuals who already have a pre-existing psychiatric condition even before the pandemic started. So in other words, sino po itong mga individuals or mga tao na to who are already dealing with a psychiatric illness? Whatever the psychiatric illness is, whether it's clinical depression or anxiety or substance related disorders, bipolar disorder, schizophrenia, what have you. No? So from the psychiatric perspective, they would fall under what we would call the vulnerable population. So I'm sure by now narinig na po natin yung vulnerable population in a general sense to COVID-19. So we are saying that the very young whose immune system are not yet fully developed, the very old whose immune system may be compromised, or even the other individuals have medical issues, what we call comorbid issues, who are considered to be generally immunocompromised. So yun po yung sinasabi natin na vulnerable population in a general sense. But from the psychiatric perspective, meron din po tayong tinatawag na vulnerable population. No? Which means that we need to pay special attention to them. No? So we need to look into whether they might need some adjustments in their medication regimen, if they are a little more on the anxious side, or if they're not able to sleep because of the pandemic, because of anxiety secondary to the pandemic, or do we need to increase the frequency of their contact with their mental health provider? So other individuals that would fall under the vulnerable population are also those who are residing in areas with high prevalence of COVID-19, those who are living with someone affected by COVID-19, or those who have a family member or close friend who has died of COVID-19. We also have those who are socially isolated, no, and those who have very little emotional support available to them. And last but certainly not the least are the healthcare professionals themselves, especially those who are in close contact with COVID-19 patients. So it is not uncommon that these healthcare professionals may experience feelings of futility or hopelessness or helplessness rather. So I'm sure that by now you've heard of stories of healthcare workers, especially in the beginning stages of the pandemic, who have somewhat expressed their frustrations about having inadequate PPEs in their workplace, which of course can in turn make them feel unsafe and anxious. There's also the issue of burnout, not just physically, but at the same time emotionally and mentally as well. And of course, on top of that, they are not able to regularly connect with their family and friends for moral support because they themselves would need to do some form of isolation. So there are also those who are compelled to practice outside of their areas of clinical expertise. So what do I mean by that? For example, even if a doctor is not an infectious disease specialist or a pulmonologist, one might feel duty bound to help out and assist perhaps in the COVID ward, no? Because of the issue of insufficient workforce, kulang po ng tao, and because you have a medical background anyway. So that can be psychologically stressful na because you are working within an area which you do not feel fully confident or competent about. But what we are saying here is that in the end, no, all of these scenarios can have adverse consequences to one's mental health. And therefore, we need to come up with an appropriate and adequate response to these issues. So, for instance, with regard to the psychological impact of social isolation, which we have actually modified the term already, right? So instead of calling it social isolation or social distancing, we would now prefer to call it physical distancing. So that can somehow be moderated by keeping the period of isolation to the shortest time possible. But at the same time, we also need to keep it consistent with both personal and public health safety. So we need to strike a balance between these two considerations. So, number two, no, another thing we can do is to provide information concerning the why of the isolation. Why are we doing it? We need to let the public know of the specific rationale as to why we need to do it. Perhaps by presenting to the public its benefits. So, we need to be very concrete and specific about this. No? There is also the importance of being conscious about maintaining or improving our social connectedness despite the physical distance. And I think the most common way that all of us are doing this is through the internet, right? So it is also important for us to highlight that alongside the negative effects of the pandemic, there may also be some positive mental health effects of living through a pandemic. So just to give a quick example, now, there was this Asian study conducted in Hong Kong in 2003. This was during the SARS outbreak. And what this study did was to look into the positive impact of the epidemic on the mental health of the general public. So the results showed that first, people actually started to care more about the feelings of their significant others, like their families. No? So they became more sensitive and empathetic towards their loved ones. Second, people also said that they found their family members and friends to be more supportive and to be more open, such that they would share more how they feel, more especially when they are not feeling well emotionally. Another important positive outcome that was observed was that people actually started to pay more attention to their mental health. So people took more time to rest, to relax, to exercise. So in the end, just the study concluded that just as SARS brought about negative associations to mental health, like high levels of stress, anxiety, depression, or even trauma, which are somewhat expected, on the other hand, um, it also brought about some positive consequences as well, no, such as those family and those on family and social support, as well as mental health awareness and healthy lifestyle changes, all of which somehow neutralized or cushioned the negative impact of the pandemic. So I think it's also very important for us to highlight the upside or the positive aspects of this COVID-19 pandemic. No? So, for instance, we're saying that because of the ECQ, the air pollution levels have improved significantly. And so we can see a clearer skyline in the city. Or for most of us, we're able to spend more time with family because of the enforced home quarantine. We're also able to tend to some other personal interests that are meaningful for us that we did not have the time for before the pandemic. So now, how about for the healthcare professionals and other frontliners, or even the other people who have been on ECQ but have started to go out and have begun the process of transition to what we may refer to as the new normal? So first, for healthcare professionals and other frontliners, it is important for them to feel a certain level of safety and security when they are in the workplace and while they are doing their jobs. So these are some very basic needs that have to be in place. No? So first and foremost is some level of training in COVID-19 management. And I'm not talking about anything highfalutin, but something really practical, like basic education about the disease, how it is transmitted, how do you contract it, how do you protect yourself from contracting it, what are the typical signs and symptoms, so things like that. No? We also need to ensure that the workplace has adequate supplies of PPE, and we may even have to teach our employees on how to properly wear them or even have a knowledge on how it can protect them. No? The worker also has to have access to COVID-19 testing as deemed necessary and appropriate. It may also help to develop modified or more flexible work hours for most of our employees. And it is also important that we are receiving some emotional and moral support. So, just like what we mentioned earlier, we need to be able to maintain social connectedness in spite of the physical distancing. Now, on the part of the employer, I think it will give the employees a sense of security if there is a commitment that they will receive some levels of support in the event that they might become ill. So, another relevant issue here, no, for the healthcare professionals or even the other frontliners is that, well, we all know that since the beginning of the pandemic, our frontliners have continued to do their jobs despite the risks. And because of that, we have somewhat been celebrating them for their bravery and their commitment to keeping the fundamental order of things. But what we may not be fully appreciating here is the fact that they may also be experiencing what we call an internal dilemma about their situation, which is that on the one hand, they may really have that innate desire to continue responding to their call of duty. But on the other hand, there's also that anxiety of exposure to the virus and the need to preserve their lives. No? And that internal conflict can be psychologically stressful as well. So what we are saying here is that just as it is important to ensure the physical safety of our frontliners, we also need to address their psychological health. Even those people who have started to reintegrate themselves back to the workplace, perhaps by making sure that the organizations and the companies that these people are working for would provide some form of psychological or psychosocial support. And I know Dr. Vergara will be talking about that or elaborating on that later on. Whether it is in the form of supportive counseling, or at the very least providing them with basic skills on how to manage their stress in relation to these timely workplace issues. And all of us will eventually be a frontliner because eventually all of us will need to go out of the house, right? So, another way to meet the possible mental health challenges of COVID 19 is to increase our mental health surveillance in the workplace. No? So, an example of this is to be able to conduct routine and regular screenings for common mental health issues like depression, anxiety, adjustment disorder, or other adjustment issues, substance use or substance abuse. What I wasn't able to add here was actually traumatic related issues or PTSD, while providing greater availability of mental health services. And with regard to the issue of providing mental health services, I think that there's actually no greater time to expand that and increase that than today, than now. Now, why am I saying that? Um, because, for instance, now with our medical specialty, which is psychiatry, ours is actually a field of medicine that is very much suited to the use of virtual methods in providing mental health services. And these virtual methods, well, practically everybody is turning to that and utilizing that now, right? Whether it be medical consults like what we psychiatrists and other medical specialists are doing now, or we have business meetings online, we're doing school classes online, or workshops or webinars like this one we are doing now. And I just want to add, no, telemedicine or providing medical consults and services virtually, it has actually been in existence for almost 3 decades already. And it had to take the impetus of COVID-19 for us doctors to overcome our resistance to make use of it. So we're kind of forced to go with the flow of the times now. So on a final note, we just want to stress the importance of timely and efficient coordination among our national and local governments, no, together with our healthcare sector, both in the availability and the delivery of mental health services. And I guess more so, I want to stress that specifically in the underserved areas. No, and what I have mentioned are just a basic but very vital strategies. No? And in the interest of time. But there can be a whole lot more. So we can form support groups, we can form peer counseling services, we can put up more crisis helplines, we can expand services and enhance accessibility through the use of telemedicine, like we mentioned. We can also formalize linkages between primary care and specialty mental health services and a lot of other strategies. No? So, careful planning and integrating of all of these will really be critical to minimizing the adverse mental health effects of the COVID 19 pandemic.
Thank you very much, Dr. Rene Samaniego, for
Thank
that.
you.
My very basic question is, thank you for your comprehensive presentation, which brings to light the importance of taking care of our mental health, not only during the pandemic and post-pandemic, but for the rest of our lives. But Filipinos, let's say, even in the cities and even in the far-flung underserved areas, first, how can you detect if you have declining mental health? Kasi alam natin, pag meron tayong sipon or
Mhm.
ubo, alam natin. Pero
Yeah,
yung mental health, parang hindi pa tayo conscious masyado
correct.
kung may
Yeah.
problema ba tayo. At
Mhm.
pangalawang tanong, if we notice that we have some mental health issue, simula pa lang or lumalala, where do we go? You said linkages. Pero does that exist, let's say, in the informal settler areas of
Mhm.
Metro Manila? Does that exist in the boondocks, let's say, in the mountain barangays in my home province of Antique? Mukhang wala.
Yes.
So, saan tayo pupunta? At papaano natin gagawin yun? Yan, very
Yeah.
basic question, doctor.
Okay. So to answer your first question, Kong Lauren, regarding po the detection, no, whether it's the declining mental health, kasi we have a lot of psychiatric disorders, di po ba? We have depression, anxiety, schizophrenia, bipolar, which are among the more common ones, it would depend po on the specific symptoms of these disorders. And that can be a long discussion. But maybe let's start with a very basic disorder, which is depression, which is actually the most common psychiatric condition. So very basic symptoms of depression. Actually, dalawa lang. Marami po siya, but there are two core symptoms of depression. First, of course, is depressed mood. But this is not ordinary sadness. Ang sadness po ng isang tao who is suffering from depression is generalized, which means that the individual is feeling sad more hours of the day than not, more days of the week than not. No? And the other important symptom is what we call anhedonia, or loss of interest and pleasure in one's activities. That's why nakikita po natin for a lot of depressed patients, they want to withdraw from their usual activities. They don't do their hobbies anymore, or sometimes they even get to the point of not being able to function, which is something I want to point out. Kasi po yung functionality, that is the common thread of a lot of psychiatric disorders. Pag sinabi po nating functionality, ano po ba yung basic functioning nitong individual na to? Pumapasok po ba siya sa school? Nagtatrabaho po ba siya? Because any psychiatric disorder, pag po umabot na sa punto na na-affect na po ang functionality ng individual, then that is definitely a signal that they need to seek a professional consult. They may start with a psychologist or a counselor, and then, of course, the psychologist can assess if they would further need help of a psychiatrist, because pwede na pong pumasok na kailangan na po tayong magbigay ng medication. Now,
So ang maraming trabaho at may mga ginagawang responsibilidad, maski tayo'y nakakulong sa bahay nung panahon ng ECQ, or maski na gardening or maliliit na bagay, ay mahalaga, hindi ba? It was
yes,
part of
apo,
coping. Is that, am I? So
correct.
giving people a lot of work is good, right? Anti-depression.
Yeah, definitely. Kasi po, it
Okay.
gives them a sense of productivity. No? Now, I think you actually raised a very relevant question, Kong Lauren, about paano po nakakarating itong tulong na to sa mga underserved areas, like yung sabi niyo po, mga informal settlers, no? Now, I know you're familiar po with the Mental Health Act, no? And nasasaklaw po nun, sinasabi po doon sa Mental Health Act natin na ideally, lahat po ng Filipinos ay dapat maabot ng mental health services. No? So I know
Ang
it's one,
batas ay batas at hindi
yes,
palagi napapatupad. Oo.
exactly. So, yun po actually yung greatest challenge natin eh. So, even if nagdiwang po tayo sa pagpasa ng Mental Health Act, of course, the next step is yung pagpapatupad nito. That's why part of my presentation, sinabi ko po na importante po yung coordination, talagang effective coordination among our government units para po
Pwede ba tayong,
ma-achieve yon.
yeah, sorry. As a former president of the Psychiatric Society of the Philippines and a continuing practitioner in psychotherapy and psychiatry, meron ba kayong mabibigay ngayon na isang hotline or isang organisasyon nationwide na yung mga, ang dami, nag-Facebook ngayon, saan daw
Yes.
sila makakatawag or makaka-Facebook man lang, or in any online platform? Is there any link you can give us?
Yes. Actually, meron po ang Philippine Psychiatric Association. I will look for the number here while Dr.
Okay.
Vergara is giving her presentation. And
Then I will
maybe pwede
post
po
it.
nating
Yes.
i-flash mamaya. Or maybe we can
Yes.
even flash it on your Facebook account.
Very
Marami
good.
po tayong numbers na pwedeng tawagan. May ang Philippine Psychiatric Association or even our other tertiary hospitals are actually providing free consultation specifically for our frontliners, no? Or
So
sometimes
there's a
even for the
special,
relatives.
I see. There's a
Apa.
special consultation for frontliners, or is this a generic online platform where people can communicate and call?
It's not a generic online platform, Kong Lauren, but yung pong individual tertiary hospitals natin, like I know for one, Makati Med is giving free consultations for frontliners.
Frontliners. That's very good.
Medical City also. The Philippine Psychiatric Association, I'm sure meron po tayong number doon. So that has been established already. So meron po tayo nitong free services na to. And maybe an important aspect here is to let the public know. No?
Very good. So after this, you will give us the contacts of psychiatric services online, and I will post it in my Facebook so that those who are asking many questions and how to go about it, yes, we will be doing that. I'm sure the Red Cross later would be able to tell us because we have a social worker, Mr. Morales, and I'm sure our WHO national officer would be able to give us that help as well. We can see with so much interest here on people's interest in having their mental health taken care of. Would you be able to give us, aside from observing ourselves and going to hotlines and psychiatric services, ano yung nutrition, exercise, gardening, ano ba yung pang-araw-araw na pwedeng
Yes.
gawin para preventive sa mental health, or kung nagsisimula pa lang ay maaring maagapan natin maski walang doktor. Meron
Right.
bang ganun, Dr. Rene?
Yes, definitely, Kong Lauren. Bali po, actually, all of those things you said are very practical approaches. You mentioned about gardening, uh, either gardening or having some connection with nature. You know, even going out in the mornings and taking a walk in your garden, or if you don't have a garden, if it's possible for you to go out shortly and connect with nature, that's one thing. But even if we are indoors, marami pong practical approaches like meditation. So there's yoga, physical exercise, kahit ano pong form of physical activity is actually an official recommendation for depression or
Mm,
even other psychiatric issues. So
mm,
marami po tayong free resources online. Mag-YouTube lang po tayo, or we can Google that. We can Google, for example, mindfulness practice is medyo it's getting into the mainstream now. So a lot of people are practicing mindfulness, meditation, like I mentioned, yoga, or well, you mentioned you have your herbs and your I myself am very much into essential oils. So marami pong approaches
interesting.
eh.
Interesting. We can have another session on herbs and essential oils, but our time now is so limited. But we can also have another session on mindfulness. Napakahalaga niyan. Oo. I've been reading about mindfulness, and not many people really understand its importance. In fact, my staff who are online now would always say, you have to be more mindful. And we have scheduled a mindfulness session with Dr. Rene Samaniego. Perhaps you can also tell them. I know you've many clients and you do many sessions, but perhaps companies may want you to give mindfulness sessions and other sessions. Would you be able to give perhaps your Facebook address where they could navigate you or find you, Dr. Samaniego?
Sure, I can share that with participants later.
Okay, thank you very much. I know that you have to go. You have a session at 11. We respect your time. We apologize that we were 10 minutes late because of technical glitches, which is trying my patience.
No problem.
You know? And so, Dr. Rene, is there something else you'd like to say to us? And for me, we've only touched the tip of the iceberg, because when I speak
Yes.
to you, it's never ending. There's
Mm-mm.
so much interest, from mindfulness to essential oils to psychotherapy to depression and anxiety. Sa totoo lang, mahirap yatang malaman ano ba ang diferensya ng stress at anxiety. Yung
Mm-mm.
depression, medyo na tuntun mo ay medyo iba yon. Pero yung stress at anxiety, dahil bago pa yung pandemic, marami ng stress at anxiety sa
Correct.
ating lipunan,
Correct.
di ba?
Apo.
Oo.
Yeah. Yeah, so stress is a part of life. It's been there forever, no? So like what we always say in therapy, specifically from the cognitive behavioral therapy perspective, it really will all depend on how we perceive stress. How we are going to deal with stress depends on how we deal with it. It's not the stress itself. So for example, itong pandemya na to, no? So there are a lot of people who are reacting psychologically, whether through depression, anxiety, and all that. But a perspective we can adopt, and maybe this could be my sort of my closing spiel. A perspective we can adopt is this is not the first time we're dealing with crisis, whether personal or collective. This may be the biggest one yet, no, but we have dealt with crisis in the past. So I always tell my patients that it's also important for us to tap into the resources that we have been able to accumulate over time. Hindi naman po tayo completely helpless about about crisis. So because we have dealt with crisis in the past, and we can always deal with this, and everything, there's a beginning and ending to everything. So we will just need to see ourselves through this.
Ang ganda ng sinabi mo. There's a beginning and ending. Kaya nga pag sinasabi ko, malapit na.
Mhm.
6 na buwan na lang.
Yeah.
12 months na lang.
Mm.
O sabihin nila, hindi, matagal pa. O sige, 24 months. O,
Yeah.
sa isang lifetime, ano ba yung 24 months?
Correct.
Parang nagsakripisyo ka lang. Pero
Correct.
kita mo, there are blue skies and the birds are chirping, right?
And we
Just,
don't wait. We don't wait till the end. We need to
yes,
do what we need to do today.
correct.
We don't set our mind to kailan kaya to matatapos. So it's not that. We
We
need to
live
do
the
what we need to
present.
do. Yeah.
Is it correct to say, Dr. Samaniego, let's just live the present moment and be grateful for the moment? Ako, di ba
Yes.
simpleng mantra? Live the moment, be grateful, and do what
Yes.
we can given the situation. Nothing is ever going to be perfect, but be grateful.
Yes. Because
When you
strictly,
wake
this
up
is the
and we're
only
alive, we
moment we
don't have
have.
COVID, be grateful,
Correct.
right?
Correct. Yes.
Parang ako na yata nag-lecture kay Dr. Thank you very much,
Thank you very
Dr.
much,
Rene
Kong Lauren.
Samaniego. Yes, and we will schedule our mindfulness sessions with you individually or even as a group. And we will post the contact details, if he allows it, of the organization of Dr. Rene
Sure.
Samaniego, a practicing psychotherapist and psychiatrist and former president of the Philippine Psychiatric Society. And we thank you, Dr. Rene. I know that you have another session now. We welcome a lovely lady who is also an expert in mental health. She's a mental health and substance abuse worker and expert on the National Professional Officer of the WHO. And before joining WHO, Dr. Jasmine Vergara was a consultant psychiatrist at the Ministry of Health. How interesting, in Palau. Ang ganda ron, ang tagal, from 2011 to 2017. You probably are a diver, right, Dr. Vergara? Because ang ganda ng diving sa Palau, I know. And she was also clinical administrator and psychiatrist of the One Algon Place Foundation, dedicated to help people in need of rehabilitation suffering from drug dependency, alcoholics, and codependence. And she was also with Makati Medical Center, just like Dr. Rene Samaniego. So Dr. Jasmine Vergara, before we ask you questions, we would like to see your presentation and learn from you. Dr. Vergara, are you with us on the line? Thank you for joining us.
Yes, good morning, Deputy Speaker.
Good morning.
Thank you so much for inviting us and your staff for having us here at your webinar. And thank you, Dr. Rene Samaniego, for that comprehensive presentation. Next slide, please. So I'll be presenting the mental health and psychosocial aspects of the COVID-19 response. And as part of, as WHO, the UN Specialized Agency for Health since 1948, our mission is to promote health, keep the world safe, and serve the vulnerable. We work in countries and globally as well to meet the triple billion goals, which are having to have 1 billion more people benefiting from universal health coverage, 1 billion more people better protected from health emergencies such as this COVID-19 and other forms of disasters, and 1 billion more people enjoying better health and well-being. And that's the promotion of mental health. Next slide. In the WHO Constitution's definition of health, mental health is an integral and essential component of health. We want to specify here that an important implication of this definition is that mental health is more than just the absence of mental disorders or disabilities. Next slide. And this is the definition of mental health. And as also mentioned by Dr. Rene, mental health is fundamental to our collective and our individual ability as humans to think, to feel, or to have that emotion, to interact with one another, to earn a living and enjoy life. On this basis, the promotion, the protection, the restoration of mental health can be regarded as a vital concern for anyone, for any individuals, the communities, and societies throughout the world. Next slide. And at the highest level of the United Nations Secretary General released recently the policy brief. And as in this COVID-19 crisis, although COVID-19 crisis in the first instance is a physical health crisis, it has the seeds of major mental health crisis as well if actions are not taken. So having to have good mental health is critical to the functioning of society at best of times, and it must be at the front and center of the country's response to recovery and from the COVID-19 pandemic and beyond the future. Next slide. And as also elaborated earlier, the fear, the mental health in COVID-19, having to have fear, worry, and stress are normal responses in this situation. And it's understandable that people are experiencing this in the context of the COVID-19. Next slide. Added to fear, contracting the virus in this pandemic, and significant changes in our daily lives as our movements are restricted, in support of efforts to contain and slow down the spread of the virus. This is the reason why, as asked by Dr. Rene earlier, this is why we have this quarantine restriction of movement to contain and stop the spread of the virus, limits its infection, and mental health could be a crucial component in this. Faced with new realities of working from home, temporary unemployment, or having to shift other forms of livelihood, homeschooling for children, and lack of physical contact with family members, friends, and colleagues, it is important that we look after our mental health the same way that we look after our physical health. Next slide. So WHO and together with our partners in the country, of course, we have our different agencies as part of the Mental Health Act implementation, the different societies, organizations such as the Philippine Psychiatric Association, Red Cross, the Department of Health, Department of Education, the Department of Social Welfare and Development is working closely with the Department of Health, which we are directly supporting and providing guidance and technical advice during this COVID-19 pandemic, especially for healthcare workers, the frontliners, the managers of the health facilities, people who are looking after children. We also provide advice for people who are, the older adults, people are in isolation or in quarantine, people who have pre-existing medical or mental health conditions, and public in general. So to help look after our mental health, we support the Department of Health in convening health sector and cluster meetings, such as the mental health and psychosocial support subcluster. And these are our interim guidance, published tools and materials. You can find here the interim guidance on mental health and psychosocial support, some storybook for children age 6 to 11, so they can be helped how to cope with the current COVID situation. Doing what matters in times of stress that I'll be explaining further later. Some basic psychosocial skills for frontline workers that is not just specific for healthcare workers, but it's for anyone at the front lines. WHO sits in the interagency standing committee on this publication of these books. Next slide. In the COVID-19 or in any emergency situation, and what we call it the mental health and psychosocial support, we have this what you call the intervention pyramid for the MHPSS. So if you notice there, the base, the different levels of the pyramid recommends that multiple levels of intervention should be integrated. It doesn't have to be sole intervention, but mental health should be integrated into health and social services, of the outbreak or the emergencies. So this also coincides with the full spectrum of mental health. So having to have, mild or no symptoms of mental health conditions or issues, having to have mild, moderate conditions, chronic conditions, or even the recovery. And as you notice, at the base of the pyramid, we would like to look into the intervention on social considerations in the basic services and security. It can be in the form of, those relocation of individuals to have a safe but dignified place to stay and protected. At the next level, strengthening community and family supports. This is where we activate, child spaces or the element of self-care or promotion of self-care strategies. At the next level, some focused person-to-person, non-specialized supports. It can be given, psychological interventions can be given by non-psychiatrists, by non-psychologists, or specialized individuals, but the mental health screening and brief intervention can be provided. And at the highest level, it can be the specialized services, such as the psychiatrist or the facility that are the services that are provided in the facility. So it has to be covered in the full spectrum. Next slide. So we'd like to, what we want to focus for the healthcare workers, our messages to the healthcare workers, as also expounded by Dr. Rene earlier, that for healthcare workers, feeling stress or under pressure is likely the same experience as anyone in your field would be most likely feeling, and it's quite normal, but stress and the feelings are associated with it are by no means a reflection that you cannot do your job or that you are not weak. This is not an equivalent of that. In fact, some people view stress as a motivation to find their purpose, how they are responding in this COVID-19 situation. In essence, managing your mental health and psychosocial well-being during this time is just as important as managing your physical health, and try to get some helpful coping strategies, such as having to have sufficient rest and recuperation in between shifts. You are able to eat sufficient and healthy food. You are able to engage in physical activities, and you're able to connect with family and friends. What's important here also to highlight is we should also avoid using unhelpful coping strategies, such as using tobacco, alcohol, or other drugs, which may be a common. People might think that they are using this forms of alcohol and drugs at a short term, but in long term can have long-term consequences in their physical and their mental health as well. Having to turn to colleagues or your managers or your trusted persons for social support, and when you also engage with people with intellectual or cognitive psychosocial disabilities, having to have understandable ways to share messages to them. A clear message that we want to share to the frontline workers or the healthcare workers are this response or what they are doing now, and having to have to keep themselves psychologically well is this is not a sprint, this is a marathon. And as you mentioned earlier, there's we will have to have them stretch still until we reach the end, the finish line, right? And having to go back to the strengths and the things or strategies that have worked with them in the past is crucial for them to manage their stress at this time. Next slide. So for team leaders and managers, we would like to highlight that these are our messages for healthcare workers and non-health on the non-health sector as well. Keeping all staff protected from chronic stress and poor mental health during this response means they will have to have better capacity to fulfill their roles. What we want to highlight here is looking at long-term perspective, not the short term. Be sure to keep in mind that current situation will not go away overnight, right? And that we should focus on, long-term occupational capacity rather than short-term crisis response, having to put band-aids and all. So some practical strategies that we can have advice is maybe partner in experienced workers with more experienced workers as a body system to provide that competence to go through that work level. At the same time, assure that good quality communication and accurate information are provided to the healthcare or to the staff, and rotate them from more for stressful loads to less stressful ones, and vice versa. Facilitate to and ensure that staff are aware of where they can access help when they need them. Next slide. I want to share this illustrated guide briefly, but it is available in our website, the who.int. This is the Doing What Matters in Times of Stress. It is a stress management guide to coping in adversity. It can be used for any forms of a crisis. It aims at equipping people with practical skills to cope with stress. It has some, you can learn practical skills such as grounding, you call it unhooking, acting on your values, or being kind, or making some room. A few minutes each day can actually help them, get that self-help techniques. It also has audio guide, so it can be guided while you also are practicing those skills. Next.
Excuse me, Doc, how do we access this? Is it online?
Yes, I'll show you the Congressman Lauren later, the website where you can access this, as well as the audio guide.
So everything you're telling us, you will share us the link, just like Dr. Rene will also give us the contact details, and I will post it on my Facebook page, or they can go to the WHO Facebook page or website as well. But for easier navigation, those who are our Facebook friends and watching us may know and use the audio guide for free, diba? From WHO. I will put the link in my Facebook page. Thank you. Proceed, please, Doctor.
Next slide. So as mentioned, everybody, just to briefly go through this stress management guide, you can find this little, document there that, a statement that everyone experiences stress at times, and a little bit of stress is not a problem because this is part of life. Next slide. But very high stress often affect the body, and many people get unpleasant feelings, that feelings and thoughts. You get also some physical symptoms such as headaches, back pains, not feeling hungry or too hungry, right? Very hungry, lump in the throat, chest heaviness, and tight muscles. So other people also may experience some skin rashes or infection or other forms of illnesses, or their conditions in the past that might be exacerbated. Next slide. So when stressed, many people, when a level of stress is not, when a person is unable to actually manage the stress, that level of not normal anymore of stress, many people cannot focus, you get easily angry, cannot sit still, worry, a lot of thoughts and feelings. And many of us think a lot of bad things from the past or bad things that we fear in the future. So it's overwhelming. Next slide. And these powerful thoughts and feelings, although they are a natural part of stress, but problems can occur if we get hooked by them. When you get hooked, somehow you cannot get away with it. Next slides. When these difficult thoughts and feelings, hook us, and we are pulled away from our values. And for example, when a person is, he values and he asserts himself as someone who's caring, calming, or calm or responsible. And again, when he is hooked with thoughts, difficult thoughts and feelings, he is pulled away from those values. He can have some form of behavioral changes that are not, not yourself. Example, there are many kinds of difficult thoughts and feelings that can possibly hook us. This can be like thoughts of giving up, or like thoughts of blaming others, harsh judgments about difficult events or ourselves. And when we get hooked by these difficult thoughts, you being responsible, you being attentive and loving, you become a different person, and you may be starting doing things that make our lives worse, right? Next slide. Just to illustrate that, I hope that everyone can see this. So in stressful situations such as any form of adversities, difficult thoughts and feelings hook us, and we are pulled away from our values. If you are a person who are caring, you care for your older family member in at home, or you're a caring mom, or a loving sister, or thoughtful colleague, and during stressful situations, you are hooked with difficult thoughts and feelings. You are pulled away, and you become someone that angry, different person that are sometimes you don't recognize yourself, and that is how the consequence of if you're unable to handle your stress. So with that, next slide, please. Learning practical skills for dealing with stress, such as grounding. This book can help you learn those practical skills, practice them every day until you have mastered them in such a way that you are able to engage in life, pay attention to others, focus on what you are doing, and live by our values. We are able to manage stress better. So there are different ways of having that. Next slide. This is the website.
Doing what matters in times of stress. Okay.
Yes. You can find it at who.int, and then you can search for mental health or doing what matters in times of stress. And you can download the book freely and go to the guide yourself. And then you also can find there the links to the different audio guide that, the grounding, the awareness of drinking, unhooking, managing, or acting on your, making room rather, or acting on your values. So those are the practical skills that you can find there. Next slide. So just in summary and in a brief snapshot of what anyone can actually do to cope with the stresses of the COVID-19. So we have released this little, brief info card. It's normal to feel sad and stressed, confused, scared at times. Talking to people you trust can help. Doesn't have to be the social worker, doesn't have to be the professional ahead, but at a level that you can have a friend, a family member with you, or a trusted colleague that you can actually help and listen to you on what you're feeling or going through. If you must stay home, maintain a healthy lifestyle. For adults, we recommend 30 minutes of physical activities every day. For children, it can be up to about 1 hour. That's the recommendation. For your sleep, proper diet and sleep, social contacts are with your loved ones is encouraged. Avoid smoking, drinking alcohol and other drugs to deal with your emotions. And if you feel overwhelmed, there are crisis hotline. Aside from the Philippine Psychiatric Association, the National Center for Mental Health through the Department of Health has a crisis hotline. They have a short code, the landline 1553. for crisis hotline, Globe hotline 0917 899 8727.
We take
And
note of that and we will flash it and put it permanently on our Facebook page. Can you please
yes,
repeat the hotline, Doctor? 15.
for NCMH crisis hotline, they have a landline to landline toll free. That's dial 1553.
I will dial that. I will see how they answer and I
Sure.
will ask questions. I'll
Yes,
test them without saying who it is.
exactly. Opo. And then on the Globe po, they have 0917 899 USAP 8727. They also have a landline, also another landline is 027 989 8727. The Department of Health National Center for Mental Health also offers tele-mental health. It's an online platform that they can log on. I believe they can find it on the National Center for Mental Health Crisis Hotline Facebook page, where they can book appointments, especially for the frontline workers and our OFW, or our Filipino repatriates. Now, there are repatriates. They have a specific channel to cater for this population.
But
And just,
doctor, how about COVID patients? We always speak about ourselves or perhaps the frontliners, and all of us should be protected and be conscious about our mental health. And how about those who are physically recovering from COVID and the mental health of those patients and how they cope with adjusting from the disease and becoming negative COVID and the stigma that is attached to it. It seems like, and I have messages from former COVID positive patients who said that in the recovery phase, it seems like the focus is on the physical medical recovery, but not focused on the mental health recovery. There seems to be a gap there. I'm
yeah.
not sure if it's accurate.
Thank you for highlighting that, Kong Lauren. The thing is, what we want to highlight with the mental health and psychosocial support, it should be integrated in the different levels of care. May it be the let's say the contact tracing when the COVID patient, patient with COVID-19 is in isolation, it has to be given there. Sometimes even the people who are in quarantine, actually the mental health and psychosocial support, when the doctors come and check on them every day, how are you doing? That's part of the mental health and psychosocial response, actually. Having to provide them basic needs, where to go after, that's part of the response. And that level of care that I showed earlier, having to have, if they have mild symptoms, where in the community they can access that support, or at the level of the municipal health office, the physician that are trained on, let's say, mental health screening and intervention can be provided. They can be provided support in that aspect, and the crisis hotline as well. There are different levels po. Actually, even at the, I believe even in the isolation, when they are admitted, the LMS, those little token, we call it the mental health kits. Some people are provided with mental health kits. It's kind of like a kit that they can do, and they can have, little notes of encouragement, some art materials at home, in their rooms. Those are part.
I think that's important, yes. For all
Yes.
COVID patients, it's not easy to be isolated, to have either some audio messages, music, calming music, or art materials. Yes, why not? Yes.
Yes po.
Thank
Yes
you.
po.
So, yes, you still have art cards. There's so much we could ask you. Unfortunately, the time is so limited, but go ahead, and I would like you to finish your presentation, Dr. Jasmine.
Thank you, Kong Larry. Actually, I just like to highlight to end, since we are focusing also for the frontline workers and their managers. My final message would be, looking after yourself and the team members while working in the COVID-19 response is not a luxury. It is a responsibility. And it also goes with everyone else in the general public. going to the new normal, this is a have to have in our all in our awareness that it's our responsibility to take care of our own mental health. Thank you.
So for all frontliners, whether they are medical and health practitioners, or even those working, let's say, in supermarkets and grocery stores or in security, uh, security offices, all frontliners, even garbage collectors, all of that, how do they access mental health practitioners? How do they get helped when they are confused and stressed and anxious? How do the jobless Filipinos who've been laid off their jobs, how do returning Filipinos access mental health services? Director, Dr. Jasmine.
Thank you, Kong. I guess those are different levels, like I said, different levels of need and different levels of intervention also. And I guess that's a good segue for the Pred, because he will be sharing a more or less that broader support to have that access of care.
The Red Cross, yes.
Yes.
And last question before I let you go, do you actually train local governments on how to handle mental health cases, or actually to set up virtual tele health care sessions, mental health care sessions, or even face-to-face later on when it's allowed? Does the WHO, in partnership with DOH and LGUs, do training? Just like, let's say, we do DRR training, and we are mandating DRR officers in every province and municipality LGU. Do we do mental health training for our DRR officers and or LGUs, mayors and barangay health workers, so that they can be the frontliners who can help people in local governments insofar as mental health is concerned?
Indeed, Kong. That's one of our mandates. Other than the providing technical assistance, is the capacity building. At the national level, we capacitate like the regional counterparts of the different, let's say, mental health coordinators, and then we have set up some example on the substance abuse model. We have set up and partner with LGUs to bring out recovery clinics, and then capacitating them via virtual capacity webinars, rather. Telehealth, innovations of provision of mental health and psychosocial support will be in place. So actually, Lauren, we're designing with the Department of Health, together with some, we call it non-pharmaceutical intervention. Other than the mental health and psychosocial support trainings, there will be some form of non-pharmaceutical interventions of how this can be integrated, let's say, in the workplace or the different settings. So that's our part. We provide trainings.
Provide training. So that's very good. You could also give us the details on how local governments who are with us now. I'm certain that my local governments at Antique are with us. I'm certain that other congressional offices and local governments are also with us now on Facebook. Perhaps you could give us more details on how LGUs can access training with WHO, and so that they can have medical mental health experts in LGUs. Thank you very much, Dr. Jasmine Vergara, for sharing with us your knowledge and the interventions for our frontliners. And moving forward, we want LGUs trained in mental health. Just like I authored the law on climate change and disaster risk reduction, this is part of it, taking care not just our physical health, but of our mental health. And you will hear from me and my office on how perhaps Antique can be made a model, because sad to say, there are some cases of mental health issues even before the pandemic, maybe because of the conditions there. It's a beautiful province, but there was poverty before I became the representative, but that is being solved now because of interventions in public projects. But perhaps you can help us set up a good mental health system to be able to help our people of the province of Antique and many other provinces who would need your expertise. Thank you very much. And we move on to Mr.
Thank
Prednison
you.
Morales. Thank you, Dr. Jasmine Vergara. As a social worker who has been in close touch, how do we say, up close and personal with the sad stories, with the deaths, with the illness, with the mental health issues. Tell us your story, Mr. Morales.
Thank you very much, Deputy Speaker, Congresswoman Lauren Legarda. It is our honor to be part of this online session. Kaisa po ninyo kami no, sa pagsulong din po ng DRR at natutuwa din po kami dahil ikinakabit po natin ang mental health doon po sa DRR activities po na ginagawa natin or binibigyan po natin ng advokasya. So bago po ang lahat, nagpapasalamat din po kay Dr. Samaniego and Dr. Vergara for sharing very good presentations about mental health and psychosocial support. Magpapakilala po ako. Ako po si Prednison Morales, isa po akong social worker, and I am the psychosocial support focal person of the Philippine Red Cross. Next slide, please. The PRC, or the Philippine Red Cross, has been responsive to different disasters, armed conflict, and health emergencies and other humanitarian emergencies happening in the country. And as everyone knows, we do a lot, no? From disasters and relief efforts to health emergencies, even blood services, rescue ambulance, and welfare services. Ito po ay ginagawa po natin sa panguna po ng aming chairman, Senator Richard Gordon. And now I'm going to show you or share with you the psychosocial support interventions or efforts na ginagawa po ng Philippine Red Cross. So the psychosocial support of the Philippine Red Cross aims to provide practical and basic psychological support to those who are experiencing crisis situations and help them to cope with their situation. So it is already part of our emergency or disaster response. No? Hindi lamang po kami nagpo-focus doon po sa disaster management, but of course, we see to it na meron po kaming psychosocial support or kasama po ito sa pagtulong po natin sa mga nasalantang lugar, sa mga taong naapektuhan at lalo higit po ngayon no, sa mga taong naapektuhan po ng COVID-19. So the Philippine Red Cross recognize yung mga nangyayaring problema, no, yung impact po ng COVID na ito sa buhay po ng bawat Pilipino. At nabanggit na rin po yung iba nila Dr. Samaniego and Dr. Vergara. At yun po yung mga dahilan kung bakit po kami gumagawa ng iba't ibang mga psychosocial support intervention. So yun po yung disruption ng normal or usual way of life ng mga tao, no, naapektuhan ng edukasyon, maging ang mga bata. Marami po ang nawalan ng trabaho at ang impact nito ay most especially doon po sa mga kababayan po natin na may hirap, yung mga hand-to-mouth po na mga kababayan po natin, yung mga nahawahan o nagkaroon ng COVID-19. No? So hindi lamang po yung sakit o yung pagkakaroon ng sakit ang problema nila, kakibat po nito yung tinatawag po nating stigmatization, no? Na kinakaharap din po hindi lamang po nila pati po ng kanilang mga pamilya at yung pagpapahirap pa po sa mga nagdadalamhati, sa mga namatayan, no? Sa mga nawalan ng mahal sa buhay dahil sa COVID-19. Isa po ito sa mga pinoproblema din po nila sa communities. And of course, sorry po, pakibalik po sa last slide. Ayan. And of course, tumatanggap din po, nakakatanggap po kami ng mga iba't ibang mga calls na may patungkol sa mental health, especially may mga number of suicide cases po tayo or mga tawag na gusto nilang magpakamatay or nire-report nila yung kamag-anak po nila ay gusto magpakamatay. So napakadami po, no? Kasama pa rin dito yung mga problema natin sa mga returned OFWs and then mga locally stranded individuals. So ito po yung mga ginagawa, no, mga humble activities, interventions na ginagawa po natin in the Philippine Red Cross. So number one, provision of information materials on positive coping. Nabanggit nga po natin na malaki ang tulong ng impormasyon. Ano po? Dahil ito po ay nakakatulong na maabot yung mga tao ng mga tama at mahalaga impormasyon patungkol po doon sa COVID and sa sa MHPSS naman po, no, ang pinapalagana po natin o binibigay po natin sa mga community ay mga flyers na patungkol po kung paano po sila magpo-cope, no, ngayon pong quarantine, or kapag meron silang problema, binibigyan ho namin sila ng information kung saan po sila pwedeng tumawag. So with our 103 local chapters all over the Philippines, no, nagdi-disseminate po kami ng mga flyers na ito sa mga community kasi alam natin na may mga communities na hindi pa rin abot na Facebook, may mga communities na wala pa rin mga internet connection. So yun po yung pina-prioritize natin. Binibigyan po natin sila ng mga printed copies po nito para malaman po nila na meron po pwedeng tumulong sa kanila. So yun po. And of course, yung pangalawa is yung Hotline 1158, no, with the leadership of our chairman. Nagawa po kami or establish po natin yung tinatawag namin COVID-19 hotline, which is the free toll-free number, no? Idadial lang po natin yung 1158. Ito po ay isang parang call center kung saan tinatanggap po natin yung mga concerns ng mga tao, no? Iba't iba, general concerns patungkol po sa COVID-19. So yung nung una, kung i-share ko lang po, nung mauna-una po namin po ito in-establish, tungkol po sa mga kababayan natin na natatakot na bakit inuubo ako ngayon? Bakit Makati yung lalamunan ko? Okay? So may mga ganun po at ito ay tinutulungan nating maintindihan, binibigyan natin sila ng mga impormasyon, no, patungkol po doon sa COVID-19. And of course, kinakapacitate natin or tinitrain po natin sila ng psychological first aid para po pag sinagot po nila yung mga tawag ng mga distressed individuals po natin, alam po nila yung tinatawag nating tamang pagsuporta o pagbibigay po ng psychological first aid. So yun po ay libre, no? Kahit sino po ay pwede tumawag kahit wala po kayong load, i-dial lang po natin yung 1158. And kabilang din sa aming mga initiatives na ginagawa ay yung pagkakapacitate or pagkakandak po ng online training on psychological first aid. Dahil right now, alam natin na hindi pa tayo pwedeng mag-conduct ng mga usual training na ginagawa po natin. At iba rin yung pagbibigay ng psychological first aid before, no? Ngayon pong merong pandemic. So nakakontextualize po yung ginagawa po nating intervention. So ang ginagawa po natin, pinapublish natin or ina-advertise natin yung ating free training on psychological first aid. Dahil unang-una, no, mahalaga po na para po sa mga service providers, frontliners po natin, na alam po nila yung psychological first aid. Dahil ito po ay isang skill na pwede po magamit sa pagtulong kung paano po natin kakausapin ang isang tao na may problema, paano po tayo magre-respond sa kanila, at paano po natin bibigyan ng pagsuporta o tulungang kumalma sa panahon na sila po ay nakakaranas ng iba't ibang mga reactions. So as of now, continuous po yung ginagawa po nating training or capacity building, and up to date, we reached more than 5,000 frontliners, service providers all over the country, at nakaka-attend po sila ng ganito pong uri po ng webinar. And of course, kagaya din po ng binibigyan diin ni Dr. Vergara na kailangan po nating bigyan pansin ang psychosocial needs ng ating mga frontliners, ng ating mga humanitarian workers. So meron din po kaming ganitong programa as we provide psychosocial support intervention sa ating affected communities, sa mga tao. Ganon din po, inaalagaan natin yung ating mga kasamahan. Next slide, please. And of course, alam naman po natin, no, yung panibagong problema na kinakaharap din po natin ng mga OFWs or pati na rin po yung mga locally stranded individuals, no? So ngayon po meron po kami mga ginagawang efforts to reach them out dahil kung malalaman or mapapakinggan po din natin ang kanilang mga stories, no, talagang marami sa kanila ang nagpapakita ng mga stress reactions, severe stress reactions na kinakailangan na po talaga ng pagsuporta. Or kung kung ito po ay makita ng mga social workers po natin na ang kailangan na po ay mga intervention na maibibigay lamang ng mga doktor, kagaya po nila Dr. Vergara and Dr. Samaniego, inire-refer po natin sila. And of course, the locally stranded individuals, no, almost every day po nagpupunta po kami sa Pasay just to check them, no, kamustahin din po sila, tulungan sila na makontak yung kanilang mga mahal sa buhay doon po sa mga probinsya, kasi po yung malaman lang na ligtas po sila, no, yun din po ay nakakatulong na mawala or ma-reduce natin yung stress naman po ng mga kamag-anak po nila sa probinsya.
Ano
So yun
ba
po.
ang psychological first aid, Mr. Morales? As a frontliner yourself and someone who has dealt with people, I saw their psychological first aid. Kasi alam natin yung first aid sa sugat. Pero
Yes.
ano yung psychological first aid? So we operationalize, at yan ba ang training na sinasabi ng WHO ni Dr. Vergara? I see her nodding. Siguro lahat tayo dapat i-require natin ang psychological first aid. Hindi lang tayo dapat maging social worker gaya ni Mr. Morales o doktor, psychiatrist, psychologist gaya ni Dr. Vergara o ni Dr. Samaniego, but maybe matuto tayo, just like kumuha tayo ng blood pressure, kukuha tayo, marunong tayo maglagay ng band-aid, but psychological first aid, paano ba ginagawa yan ng Red Cross?
Okay po. Bali, ang psychological first aid po ay dinidefine ng International Federation of the Red Cross as a set of skill. It's a helping skill na kailangang matutunan ng isang tao na nakikipag-deal po sa isang tao na nakaranas ng distress situation. So ito pong mga skill na to ay may kinalaman sa pag-assess ng kanyang condition, no, sa pagtulong na kumalma sa isang tao, at pagtulong din po na maka-access ng support. Maraming misconception about psychological first aid. Many people thought that psychological first aid is for professionals only. In fact, kaya nga po natin ina-advocate, no, pinapalaganap yung kaalaman tungkol sa psychological first aid, dahil kahit sino po ay pwedeng gawin o isagawa ang psychological first aid. At mahalaga na kung tayo tumutulong po sa mga tao, mahalaga po na meron po tayong mga ganitong skill ng pagtulong.
Anong example ng psychological first aid? Sorry to interrupt you. Para lang maintindihan ng mga tao, maintindihan ko rin. Ano yung example ng psychological first aid? What kind of action?
Okay po. Sa psychological first aid po, no, ginagamit po natin o sinasagawa natin yung tinatawag na supportive communication, no? Kung saan tinutulungan o pinapakinggan po natin ang mga tao na mayroong pong problema, no? Inaalam ko ano yung problema po nila, the here and now situation, no? Sa ngayon, na ngayong pandemic na ito, nangyari na po yung lahat ng problema nila. May mga pangangailangan sila at this moment na nakakaapekto sa kanilang buhay, and we need to do something about it. So
sa pagtanong mo sa iyong kasama sa bahay, sa iyong kaibigan or pamilya, kamusta ka? May nararamdaman ka ba o naiisip? That's part of psychological first aid.
Correct po. Isa rin po yun, ang pagkakamusta o pag-alam ng karamdaman or ng kanilang sitwasyon ngayon. And kung tayo po ay matututo ng psychological first aid, matutulungan din po tayo na maintindihan yung mga tinatawag nating normal stress reactions. At
normal first reaction. Okay.
Yes po. At yung mga tinatawag po nating severe reactions, no? For the normal reactions po, Kong Lauren, ito po yung mga ine-express natin, no, right after an incident, o yung normal na nararanasan or nararamdaman. For example, ako po ngayon ay nakaranas ng pag-ubo, okay? At parang masama ang aking pakiramdam. And nasa gitna tayo ng pandemic. So normal na matakot po ako. Normal na makaramdam ako ng panic. O normal na umiyak ako at this moment, no? So yun po yung mga normal reactions. So sa mga severe reactions po, no, nabanggit na po ito kanina ni Doc Samaniego, no? Pero yung mga basic or mga practical na kailangan po nating malaman, una-una, if it is long lasting, kapag ito po ay matagal na nating nararanasan, kagaya ng yung tulog o pagkahirap na matulog o hindi makatulog, no? Pag ito po ay tumagal na ng 1 week, 2 weeks or 3 weeks, no po, yun po ay nangangailangan na po ng ibang pagsuporta, ng ibang tulong na magmumula po sa ating mga professionals. And of course, it's all about functioning, no po. Kung hindi na ganito o hindi nakaparehas before, yung ating ginagawa, hindi na rin tayo nakakapagtrabaho. Hindi na natin nakasikaso yung mga anak natin, hindi na sila nakapakain ng mabuti, etc. So kailangan na rin po yun. Yung may mga thoughts na gusto nilang saktan yung kanilang sarili o gusto po nilang magpakamatay or manakit po ng iba. Yun po ay mga iba't ibang mga reactions na ang kailangan na po, yung nabanggit nga po ni Doc Jasmine, no? Yung specialized service na kailangan din pong malaman ng mga tao at this moment. At kung tayo po ay PFA provider, no, binibigyan natin sila ng impormasyon. Saan ba sila pwedeng humingi ng tulong? Sino ba yung mga pwedeng kausapin? Paano ba natin sila ma-reach?
Very good.
I hope,
Mr.
si Doc
Morales,
Jasmine po may
nagbibigay ka ba ng lecture na ganyan sa mga tao? Ikaw ba ay nagbibigay ng online lecture gaya ng sinasabi mo sa mga opisina, sa grupo, sa mga barangay? Do you do that? Merong gaya ng binigay ni WHO Director Vergara ng link, ang Red Cross, meron ba kayong audio guide or visuals para ang mga tao makapunta sa Facebook o sa YouTube at makita nila yung mga sinasabi mo? Or pwede ka bang mag-sample, let's say sa opisina ko, kung magkakaroon ng mindfulness session si Dr. Rene Samaniego, pwede ka bang magbigay ng psychological first aid? Turuan mo kami kung ano yan? Kasi hindi sapat yung 15 minutes na allocated sa iyo eh. Ayan o, palagi na ang dami kong ano dito na 35 minutes na daw ako overtime. Hindi mo ako nagabayad ng airtime dito eh, libre naman. So this is public service to our people. So nagbibigay ka ba para din sa maraming nanunood sa atin? I have to read all of them later. Do you give such trainings on psychological first aid?
Again po, no, as our mandate as the Philippine Red Cross and support to the government, talagang handa po kami magsuporta. And as much as possible, as much as we can, we want to reach out even our barangay or local health workers patungkol po dito. And sa ngayon po, we are working on the videos or presentations na pwede po nila ma-access online. But for now, as much as possible, gusto po namin yung may direct interaction. So gumagawa ho kami ng mga iba't ibang platform kung saan pwede kami ma-access, no, through Facebook, through Zoom. So iba't iba pong platform, and we are more than willing to help po through our local chapters din po as well. May mga chapters din po kami, so they can just ask them, no, sa kanilang mga probinsya para po ma-access din po kami dito sa national headquarters.
You will hear from us, and my staff are listening to me, including my chief of staff. So we will have mindfulness session for the office. We will try it with Dr. Rene Samaniego. We will have collaboration with WHO Dr. Jasmine Vergara so that mental health issues, let's say in my district, in my province of Antique, can be dealt with, and we can have online clinics for mental health and other issues with Dr. Vergara, and to train LGUs on how to deal with it virtually and or face-to-face. And our social worker expert of the Red Cross, Mr. Morales, will also teach us, not just LGUs, but each and every one of us, first aid training in terms of mental health. Tama ba? Anong tawag doon? Psychosocial.
Psychological first aid po.
Psychological first aid. Yan ang mga hindi natin alam masyado. Sana meron tayong sa Red Cross website na ilalagay ko sa Facebook ko, 1, 2, 3. Hindi ba parang kunyari, meron kang headache, alam mong gagawin mo. Pag may sugat ka sa binti, alam mong gagawin mo. Pero pag meron kang declining mental health or meron kang parang suspetsa na ikaw ay na-anxious, nalulungkot, nasa stress, or depression, 1, 2, 3, anong gagawin? Gawin natin yan. Di ba, Dr. Vergara? Parang i-operationalize natin, simplehan natin yung pag-detect, yung pag-prevent, at yung paggamot sa normal na hindi kailangan ng medication. Nakakatakot ang medication. Doktor kayo, alam ninyo, pero kamukha kami, hindi pwedeng mag-inom kaagad. Kaya maganda, mag-suggest, magtanim ng halaman, mag-walking, magbisikleta. Kung walang lugar, tumingin sa langit o magpaaraw. Yung mga ganon, yung practical. Or kumanta, or magpunta sa YouTube, makinig dito, or may audio guide sa WHO, o makinig sa huni ng ibon. Or tuturuan ni Mr. Morales, ano ba ang first aid sa psychological first aid? Maraming ganun. Nako, I hate to cut this, but can you wrap up, Mr. Morales? Or is that your presentation? Okay na.
That's it po. So again po,
Thank you.
for my final message po, the Philippine Red Cross is always willing and ready to support yung ating mga local governments, even the national government, no, especially on their initiative for the mental health and psychosocial support.
Very good. Very good. And we will not stop here. The way forward is what I just mentioned. So that means there's a lot of work for my staff. Is that going to make them anxious, stressful, sad, or depressed? No. Dr. Samaniego said the more work, the better, right? Right? Do you agree, Dr. Vergara? Sabi niya, ang masama daw pag walang ginagawa. Kasi pag wala nang ginagawa, wala kang functionality. Tinanong ko kay Dr. Samaniego, di maganda pala yung maraming trabaho. Sabi niya, oo. Tama ba yon? But maybe you don't have to answer that. I will, ito ang Q&A, ang dami naman. Ang dami. Oh, our nutritionist, my nutritionist friend, Virgit Buena, good morning, Lauren. She invited nutritionists and dietitians to join the program. Oh, there's a request to do one whole webinar, a Zoom session on Facebook on nutrition and diet. Yes, we will do that. Nutrition, diet, exercise. Very good. From Mirasol Loque, Agpuldo, watching from Apayao State College. Wow! For the people in the Cordillera, buti pa kayo dyan. Ang ganda ng kabundukan. So, kinabati namin kayo. Good AM from Apayao State College. Joanne Daluz Guriba. Good morning, Lauren, from Hair Shaft. Naku, kailangan ko na po magpagupit. Pero okay lang po. Pero yan, wala yang dye, ha? Natural yan. Konti lang ang white hair. Ayan. Hair Shaft. Napakagaling yan. Yan kay Luce Britannico, but I've not seen them since last year. 30 Aguas, watching from San Jose Antique sa akon Makasimanwa. From MG Camille Ortiz, good morning. San Jose del Monte, Bulacan, hope you're all well there. Elena Ison from Bugasong Antique, very good. Sa Bugasong, ang gumagawa nitong aking suot na patadyong. This is actually a modern patadyong done by Designs by Marie of Marlene Liao's daughter, son, and this is, hinahabi ito, one by one. I will stand up. Every fiber, every thread is hand-woven by a female weaver in Bugasong Antique in my home province. I'm very proud of that. In all the stories for a better normal, I've been wearing modern t-shirts and blouses of my Kasimanwas. Okay. Bugasong from Abigail Cruzada. If, for example, of a friend who's experiencing anxiety after recovering from COVID, what can I do to help? What do we do? Yun din, meron din tinext at may Facebook message din si Attorney Ipat Luna asking from Howie Severino, also her husband, what is the help we can do for COVID patients and their mental issues and recovering and the stigma later on. Ano nga ba ang magagawa natin? Mr. Morales and Dr. Vergara for recovering COVID patients.
Kong Lauren, I believe it's the same as anyone, but the way is to support them, their integration back to the community, the family, finding back their purpose, having to have that preventive also model of care for themselves. Having to go through this, it's a crisis, it's a personal crisis also for them. Having to experience the, being away with family because of the treatment, having to get all those, follow a lot of rules for the infection to be controlled. But having to find their strength to have a purpose, their purpose back in life, I would say. And then that doing what matters in times of stress can also help out. If they're able to find some skills in that, in that journey, new hobbies or skills or strengths, they can actually more strengthen those. So it's the same po. And then how we want to look at mental health, as I mentioned earlier, is in the full spectrum. If we have some mild symptoms, we can promote like self-care strategies, some breathing exercises, for some ways of coping, as you mentioned, for planting or, lavender and everything, or even cooking. Pag may mga mild to moderate symptoms that we can have psychological support but doesn't need much of medication, that's where we have those non-specialized.
Very good.
Yes.
May we request you, it would be very helpful if we have really simple to do for former COVID patients or recovering COVID patients, what to do. Actually, it's just around us and you're saying it, but perhaps to 1, 2, 3, 4, 5, operationalize it, that would be very helpful. If we have that in the DOH, WHO, and PRC websites, very important. Like ito, Mayad Maaga, very informative, timely. Damo gid salamat. That is from Golda Ilario and Abigail Cruzada. This is what we've been talking about for almost 2 hours. How can we provide proper support to friends or family who are frontliners? Yes, sinagot yan kanina ng WHO. Or family who are experiencing psychological stress due to the pandemic. I think we've tried to answer that, but it's never enough. And we will post all the hotlines and information on our website. John Paul Gomez, watching from San Jose Antique, sa akon Kasimanwa, duro gid nga salamat. From Joy Denaco, how to cope with mental health due to the extended working hours, particularly for those who are working from home, since there are assumed to work from home. No, I think even if we work from home, there should be time, 9 to 5, 8 to 5. In fact, that's what I just told my chief of staff. Sometimes they give me work at 10 p.m. Sabi ko no, and maybe when I text, but I tell them, you answer during the first hour the next day. So there should be boundaries, right? So kung 9 to 5, 8 to 6, tapos may lunch break pa rin, maski na working from home. Am I answering the question correctly, Dr. Vergara?
Yes. Or sometimes some people create new routines at home, as you have created as well. Thank you.
Oo. So, kailangan lang may oras para sa pagkain, may oras para sa trabaho, at may oras na magla-log off dahil yun na yung time na pang sarili or pang pamilya. From Gianna Adesas, paano po magkaroon ng work-life balance kung nasa bahay ka lang and you're forced to extend your work hours? Yes, we answer that. So yung trabaho mo, kung online yung trabaho mo or tawag or computer, so dapat may taning lang ang oras at iba pa naman yung working ng housework. Tama ba ang sagot ko? Okay. Yes. From Lisa Bautista Silerio, dear Congresswoman, Lisa Silerio. Is this Lisa? I know, Lisa, my friend. Okay. Dear Cong Lauren, thank you for this informative session. More power, stay safe. Lisa Silerio of SM, I think this is Lisa. Of course, thank you again. From Rafi Beaver, cheers to both of you. Thank you for doing this. Thank you. From Zeni Velasco, President of Nutritionist Dietitians Association of the Philippines. Your next episode, please consider good nutrition to bulletproof of oneself from stress. They are two types of eustress. What is this? And distress. Okay, but we can do something on nutrition and diet. Okay, maybe that's for next week or next 2 weeks. From Richie and Esilio, just to add regarding Kong Lauren's question on the training of LGUs, DOH in partnership with Zwillig conducted nationwide trainings for LGUs in the past on the Mental Health Gap Action Program for RHUs. Very good. We will call you, for Antique to help detect and address mental health problems in LGUs. The DOH through the Mental Health Program has downloaded medications to LGUs. Sana hindi kailangan ng medication. Sana preventive and exercise and diet and nutrition. And then mahaba ito. We need more trainings. I agree with you. And we can partner with many groups. Yes. From Abigail Cruzada, again, how can we sign up for the psychological first aid training? Ayan. Paano mag-sign up? Tatawag o mag-online sa Red Cross, Prednison Morales?
Meron po tayong mga readily available schedule para po sa PFA, pero wino-work out pa po natin yan. This is in partnership with UNICEF Philippines. Pero if it's for organization, pwede po silang mag-request as organization po sa Philippine Red Cross.
Ay, ito mukhang hindi organization. Pwede ba siya pumunta lang sa Facebook ng Red Cross at mag-e-enroll sa Psycho First Aid Training? Pwede ba yun?
Maybe I can
Wala
give
pa.
my contact details po so they could
Ilagay
contact
ko sa
me.
Facebook ko.
Yes,
So sige. So sa Facebook ko ha, mga pending nyo, pasensya na, guest na kayo, na pro bono, may homework pa kayo. Public service naman to. So yung kay Red Cross, kung paano mag-sign up for a first aid training, tapos sa WHO, kung ano ang mga dapat gawin ng mga COVID patients who are recovering, and then LGU trainings as well. From Richie and Senilio, I think I read this already. Based on NDREAM-C, the different mental health needs are addressed by different agencies depending on population and target. Regarding PFA, what is PFA? Atom Araulio is
Psychological first aid po, Kang Lauren.
yes, okay. PFA, Atom Araulio has a video on Red Alert that people can watch. Is that part of the Red Cross training of Atom Araulio? Is that it?
That's ano po, their own video. Meron po silang isang segment doon tungkol psychological first aid.
So see, there's a great demand for psychological first aid. Yes, perhaps this video of Atom, I know his mother, Carol, she's a good friend. And thank you for all your, hindi ko nabasa, nasan ba yung lahat na nanonood? Basta tanan kayo. Thank you so much. Wow. Ang daming request. There's a request to do Save Our Seeds. There's a request to do permaculture and agroecology. There's a request to do dietitians and nutrition. That's so important. Kasi pag-usapan yan, kasama na naman si Lavender, kasama na naman si Basil. Am I crazy? No, I'm not crazy. This is part of my coping. At yan ay natanim ko mula sa wala ng ilang buwan. Pwede. All of us have our green thumb somewhere, somehow. But psychosocial training, we will post on our Facebook. How to recover mentally from COVID, we will post. How to train with LGUs, we will post. How to do mindful sessions and other psychotherapy sessions with Dr. Samaniego, we will post, okay? So my staff have a lot of work. I hope you are not stressed. No, because Dr. Samaniego said more work is better for all of us. But there should be time gaps, timelines, even when we are working from home. It's been, would you believe, Dr. Samaniego, Dr. Vergara, Mr. Morales, and all our Facebook friends, almost 2 hours. But when we are enlightened and educated and informed, when we are helping our people who are watching, not just in Metro Manila and in Antique, but worldwide, including the Shiloh Tabernacle in California, Pastor Ruth is also watching, and many of her friends in Europe, and many Antiqueños from Austria were also there. I think it's okay to go overtime. Maski pagod na po ako. At may So thank you very much, Dr. Rene Samaniego, Dr. Jasmine Vergara, Mr. Prednison Morales. Congratulations for all the great work that Team Gordon is doing in Red Cross and WHO and DOH as well. Sana masasagot po kaya ito na hindi konektado sa akin subject matter. Why are other countries declining and flattening the curve? Why is it rising still in the Philippines after 3 months of lockdown, Dr. Jasmine? Or maybe you may not be in a position to answer that. That's causing us some anxiety. Bakit pataas? Actually, I can answer it because it's only now that we're testing. So I answered my own question. Am I correct?
I will have to leave that to the authorized Department of Health.
I know. You cannot answer that. But I would venture to say, because we have not been testing before, and now we have more than 13,000 capacity, which is still, I think, quite low. And because sometimes some communities are behave, follow and the others are quite stubborn. So we have to follow the rules. We have to be observing the health protocols, but that's for another subject. So stories for a better normal. We talk about how life is during the pandemic, how we can cope in terms of our physical, mental, psychological, physical health, maybe religious, spiritual health as well. And you can Facebook any of the stories and the topics you want us to tackle. Thank you to the Climate Change Commission and your very hardworking team. Thank you to my Office of Deputy Speaker Legarda in the House of Representatives. Thank you for our partners, for the partnership with the Institute of Climate and Sustainable Cities, of the Mother Earth Foundation, and the Climate Reality Philippines, and the DENR and the DA as well. On Facebook, we will put how the beneficiaries of the starter kits have planted. Sana ganyan kaganda ang inyong mga gulay at herbs. And we are also giving away seeds, unlimited seeds sa Facebook na rin. And we are giving away also Protected Areas Guidebook as well as Disaster Risk Reduction Preparedness Guidebook, but that will be on our Facebook page. So maraming giveaway, especially giveaway of heartfelt, well-studied, and prepared information for a better normal. This has been Lauren Legarda, ang inyong Kasimanwa. But for those who are not Antiqueño will not understand, Kasimanwa means province mate. Thank you very much to all our experts for unselfishly sharing your expertise and knowledge to help other people. We help each other. Thank you, and have a good day. Be blessed. Be grateful. See you again. Make it your Thursday habit to join us for Stories for a Better Normal. Bye.